Welcome back. In today's mental health check, across the country, roughly 12 million Americans are living with post-traumatic stress disorder, also known as PTSD.
Yeah, that's according to data from the U.S. Veteran Affairs Department. But it's not just service members at risk. PTSD can affect anyone who has experienced a horrific or life-threatening event. So joining us now to talk about this is psychotherapist Dr. Robi Ludwig. Dr. Robi, thank you for being with us.
Thank you for having me.
Yes, especially this month because it's actually PTSD Awareness Month.
Yes.
So why is it important to pay attention to this disorder?
You know, whenever we raise awareness, we're reducing the stigma attached to any kind of disorder. It also helps people to be more empathic and understanding, and helps those who are suffering to come out and talk, because it can be a very isolating disorder where people tend to isolate and be kind of lost in their own thoughts. So we don't want that for people who are suffering, or for family members who have those they love suffering.
Yeah, I think oftentimes when you hear PTSD, you kind of associate that with our military members or service members. But talk to us about who is at risk. It sounds like, you know, anyone, really.
Yeah. Well, right. So somebody who is suffering from childhood abuse, sexual violence, crimes, natural disasters. We basically walk around feeling like we're safe and we can handle the world. And when something is so tragic that we start to believe and think of ourselves as being unsafe all the time, it could be a very scary thing. And that's how people with PTSD walk around, like the world is not safe, they are not safe, and they're not in control of their world anymore.
And I mean, those fears can be valid based on the experiences that they've had. So
yes,
what are the signs and symptoms to watch out for, both in yourself, but maybe in the people around you and those you love?
So flashbacks are a sign to look out for. Intrusive thoughts, nightmares can happen, difficulty concentrating. There could be mood shifts where someone can shift and become very hypervigilant or depressed or difficult to manage. And it is a struggle because very often they avoid people, places, and things that remind them of the original trauma. And it's difficult to treat. So they're kind of stuck in their own mental loop, which again is a very scary place to be. And there's a lot of self-loathing because of their experience.
And if you spot these signs, especially among, you know, your friends and family members, how can you support them?
So you should go to your doctor and ask for somebody who's a trauma specialist. You can go to a psychiatrist, or you can go to a therapist. Cognitive therapy is highly effective, and they have new studies about ketamine with guided psychotherapy that's very promising as well.
I wonder, is this kind of thing forever, or is it something that you get through? How does it work, especially given that PTSD is connected to past traumas?
Yeah, I mean, people can work through it and get better. We are looking at the science where treatment can actually change the brain neuroplasticity, so that's very exciting. It means the brain can grow and change and process these things differently. So there's always reason to be hopeful, and people do get through tough, difficult situations.
Let's talk about maybe the extreme. I mean, say that you're kind of going the course, talking to a physician, but, you know, you're still not, you know, you're still experiencing the symptoms of PTSD. What goes beyond that?
Well, support group is really important, to know that you're not alone, to find people around you who can listen to you, who don't expect you to feel one particular way. It's always about community, getting the treatment you need, and getting back out there so that you can feel in control of aspects of your life, and that can be very helpful.
No, it sounds like just validating experiences is so critical.
Yeah,
for those experiencing listening. And I'm sure first responders also experience some of this too.
Absolutely, because they see trauma all the time. And also basically not guilting people to feel like they should be grateful for being alive. There's a lot of survivor guilt that comes with PTSD as well. So the more we talk about it and educated we are, we'll know how to interact with people who are suffering, which also can help them to heal.
And we have about 30 seconds here, but say that you are experiencing something traumatic. Can the symptoms show up later? I mean, months, even perhaps years down the road?
Absolutely. Sometimes people bury it, and our psyche can deny it until the psyche is ready and strong enough to handle it. So it can come up years later, but you can treat it at any point that it comes up.
Yeah, so critical to validate your experiences. Dr. Robi Ludwig, thank you so much.
Thank you.
And thanks for watching.
You're watching NBC News Daily.